While my priorities for the coming year include implementing the MOA and initiating the governance review, I am deeply passionate about the plight of children and adolescents with developmental disabilities, as that is my major patient population in my clinical practice. Many of the patients I follow have a wide range of needs, often with coexisting developmental, cognitive, and mental health issues. When they reach 18 years of age, they are usually no longer eligible for pediatric and adolescent services. When these patients enter the adult system, their previous medical team and support networks are often no longer available to them to help and assist with navigation through the system, and for many, their care becomes fragmented. The burden remains often solely with their family to ensure that their care is coordinated and maintained. For patients with limited family or community supports, falling through the cracks is a huge risk. During my term as president, I intend, with the help of the NLMA staff, of course, because these guys are so amazing, I intend to gather professionals who provide care for children and adults with developmental disabilities and community stakeholders and families to identify current service gaps and formally start the beginning of developing a plan to improve the transition of this patient population from child and adolescent services to the adult system. Thank you again in the confidence you've shown in me. There are still many unresolved issues that we need to tackle as we implement the MOA, and we will be working diligently over the coming year to ensure that all of our members' concerns are addressed. The next round of negotiations is only 2 years away. Thank God my term of office is 1. We hope that the positive interactions we have had with government since December will continue. Over the next 2 years, we plan to build on our progress in rebuilding our relationship with the provincial government. We can only address the issues of sustainability and delivery of care if we are working together in an atmosphere of cooperation and mutual respect. In closing, I'd like to express my profound thanks and gratitude to the NLMA's outgoing president, Dr. Patrick O'Shea. It has been a tough and demanding year, and you have risen to the challenge with resolve, commitment, and grace. You are a testament to our profession. I and all of our colleagues appreciate your efforts over the past year immensely. You probably wouldn't have been my choice of a person to follow, though, because man, I've got some work to do. I am delighted, however, that you will continue to fill a leadership role in our ongoing governance review, and it's a very large learning curve for me in this kind of endeavor. And I'm really happy that you'll be one of the key people helping us through that review. I would like also to thank our board of directors and the doctors of our committees for their efforts and commitment to the association. I would be remiss if I did not also thank our executive director, Rob Ritter. Man, I wouldn't want to do a skin biopsy on you because you must have really thick skin. Yep, I tell you, you have handled the past year with amazing, amazing class, and I'm really proud you're my friend. You've worked incredibly hard over the last 2 years, and before that as well, in dealing with government. And I thank you for your unwavering support, your patience, and dedication to the physicians of this province, even when they're not always being that nice to you. But the majority of us do love you, and we really, really thank you for everything that you've done for us. I really don't think that we would be, I really don't think we would have reached Atlantic parity without you. And thank you very much again. I look forward to working with you and the entire staff of the NLMA over the coming year. I would also like to take this opportunity to recognize and congratulate Dr. John Haggie, who will become president of the Canadian Medical Association in August at the 2011 CMA annual meeting here in St. John's, which I hope all of you will attend. Finally, I'd like to thank my husband, Richard, and my children, Lauren, Andrew, and Daniel. Richard and Lauren are here with me tonight. They have been amazingly supportive and encouraging. I remember when Rob and others were discussing whether I would be willing to enter the succession line to be the president of the NLMA. I thought I had an out because I was going to go home and discuss it with Richard, and we have 3 young children, and he would say, no, I really don't think that's a really great idea. And he looked at me and he said, I think that's fabulous. I think we should do it. So thank you, Richard. Thank you for standing behind me and supporting me for the last year, especially during a very difficult fall, for allowing our house to be the meeting place and holding place for our meetings. In my year ahead as president, I look forward to engaging my colleagues throughout the entire province, and I pledge my best efforts to ensure the future success of our profession, with the ultimate goal, which I think is all of our goals, to deliver the best possible medical care to the people of Newfoundland and Labrador. Thank you very much. As well as Dr. Haggie. Haggie is going to make a presentation to Dr. O'Shea.
I'm sure you know what this is, but it's a gift from the association to mark you a year in office.
Thank you very much.
Enjoy it. Thank you very much.
Well, we're almost at an end. When the formal meeting finished and I went home, I turned on the TV and it was, we were watching Who Wants to Be a Millionaire, and the answer was D, dermatologists. This does bring our dinner to a close. I remind the board members that you do have a meeting at 9 a.m. tomorrow morning at NLMA House. I want to thank everyone for attending, and I'd like to thank the Geo Centre and Red Oak for a wonderful meal, wonderful catering. And I would ask all the people who were given awards to come forward at this time to have some pictures taken of yourself. And am I presenting this, or is somebody else? Okay. I am presenting an award to, I guess a gift, to our CMA President-elect, Dr. John Haggie, for just being John.
Thank you very much. Thank you.
And what is this? Does this go with it? Oh, this is more.
Oh, it's 2 bags. Lucky I drove her. I don't have to wrestle with Air Canada's baggage system.